Diabetes is like become like a mother of the disease when someone it takes few years. First, you have to focus on diabetes. High sugar floating in the body, it is going to be damaging every organ, vein, and glands and tissues. You have to get rid of that first. Every processed food, I say chemical. White bread, pasta, cereal, cake, pastry, waffle. I say it's a processed. Your body cannot handle that, and that making damage on the pancreas, liver, intestine, gut layer, everywhere.
Hello, I'm Dr. McJunkins, Austin McJunkins. Got my degree at University of South Carolina. Did some surgery training. Did 5 years in the Air Force, and now I work at a family practice in North Carolina. We'll be talking to Dr. Hawk.
I'm basically came from scientist background. I was a scientist in University of Texas Medical Branch. After finishing my PhD, I decided to start further research on my medicine because my PhD was on bioorganic chemistry, mostly cancer drug. So after finishing my school from University of Wisconsin, I moved to Texas. While I was doing my research on medicine, I realized that our medicine is not enough to fix someone's health problem completely unless you go integrative approach. Then I started focusing on all other healing support that someone need. I went to Harvard for my nutrition program. They have an amazing program. It's called Nutrition, Health, and Science. So I finished that, and then I went to integrative school for integrative medicine certification, functional medicine university for functional medicine certification. So I've been practicing now with a naturopathic background, functional medicine approach, and you can say like integrative approach. I'm helping patient to focus on underlying health issues.
A lot of people, especially around here, they've heard of diabetes and they're worried about diabetes and worried
Mhm.
about developing diabetes. So I guess it would be sort of a two-part question. One, can you keep yourself from even getting diabetes? And let's say you are already a diabetic. What can you do to no longer be a diabetic and come off the medicines? I get this question quite often as well. So I'd like to hear your thoughts.
Yes, doctor. Diabetes, as you said, that a lot of patients worried about they're going to be diabetic and someone are already diabetes. I get diabetic patient a lot because when someone have a diabetes, they develop other diseases like high blood pressure, kidney issue, neuropathy, nephropathy, everything comes in. So very first I say, okay, you want to fix your EGFR, kidney issue, you want to get rid of the blood pressure. First, you have to focus on diabetes. High sugar floating in the body, it is going to be damaging every organ, vein, and glands and tissues. You have to get rid of that first. And one interesting story, the patient in Pennsylvania, she had a high blood pressure, diabetes, kidney, EGFR drop up to CKD3 level. And she said, okay, doctor, I'm so worried about my CKD. I said, okay, I'll do in the next meeting. But the first consultation, I want to guide you how to get rid of the diabetes. And then finally, I was able to convince her, doctor, okay. And she came to me in 2 months later. She said, my kidney EGFR became 106. That was very surprising results I got. How high sugar affecting on kidney cell so much. Without even kidney support, it improved right away. And usually patients, I do first take care of the diabetes, then I support the kidney that we need. So what we do, firstly, focus on the processed food because processed food body cannot process. It already processed. It's a chemical. Every processed food, I say chemical. White bread, pasta, cereal, cake, pastry, waffle. I say it's a processed. Your body cannot handle that, and that making damage on the pancreas, liver, intestine, gut layer, everywhere. Who's supposed to be digesting our food like a carbohydrate with the support of amylase converting into calorie, but it cannot do anymore because organs are not able to process the food anymore. So what we have to do? We have to go back to our own diet, live food, not the dead food. Dr. X, he explained very nicely. He said, eat with the dirt. He actually wrote a book, Eat with the Dirt. So fresh vegetables, fruits, temporarily no carbohydrate. because body is not able to handle carbohydrate right now. Carbohydrate later. Right now, more plant-based. Yeah, they can have healthy fat, grass-fed meat, wild-caught fish, organic egg yolk. They can have them, but no carb. No carb because body is not able to metabolize carb. And then while they do that, and then get rid of all the processed food, all the fry and stuff and steak, they can improve their digestion. And in the meantime, we support their sugar metabolism, but like niacin, vitamin B6, and then bitter herbs, sometimes helps. And also we need to do exercise that time, because more you be active, your organ get a chance to heal and organ function improve. Then they can easily produce amylase and other digestive juice and enzymes to digest food well, not like making into sugar and make a sugar flow through so much in the body. And diabetic patient always in stress because high sugar makes body inflamed. So for them need relaxation, good sleep, quality sleep, and other hormone need to be balanced. And they need to, a lot of time they need to clean their gut. And then a lot of time they need to improve their digestion by apple cider vinegar, some citrus food to balance the pH level in the gut. And if someone are struggling really with a lot of problem, I say you have to do IV therapy, because when you take food, body may be able to absorb nutrient 10 to 20%. When through IV, they can get 100% straight through the IV, straight to the bloodstream. So IV sometimes very powerful to improve all the dysfunction organ. And acupuncture sometimes helps too, to help nervous system, to help stress, to help anxiety, to help their body meridians to improve their organ functions, so they can slowly get rid of the diabetes. Diabetes is like become like a mother of the disease when someone, it takes few years. And others struggle, I see a lot of patient comes all of a sudden they diagnose with a like a A1C like a 8, 9, 10, even 13, even I found someone 27 A1C, and they didn't even know.
That's a lot. I think it's kind of some of what you alluded to, and something I've been trying to push. We have a kind of a continuing, I think they call it CPI, continuing process improvement type of thing. So we're trying to push the keto diet more on our patients.
Right.
We got some handouts, just basics of it, and like it actually tells you things. Well, you could eat on the go at a fast food restaurant that are keto friendly. I find to be helpful because I have a lot of people who, they work and they can't necessarily, I guess the nice way to say is they don't have the discipline to make the meal the day before. Or they get caught up in life as one does. And so I don't know if you have any patients of yours that are kind of doing that, but I've noticed I've actually taken a lot of people off medicine.
Wow.
That have stuck to this.
Amazing.
And they'll drop 20, 30 pounds, and all of a sudden, their sugars are going from the 130s on metformin to 80s, to the point where they're almost low. And I'm like, no, we got to stop this now. And they actually normalize their A1C. I've actually seen that a few times now.
Wow.
Just from this diet. So I think people underestimate how good it could be, and it's one of those things. So I'm getting my notes pulled up here. I think it's one of those things that until you do it and try it, you have no idea how impactful it is.